If you were to ask me today, if I could tell you how young children in Canada are doing, children birth to the age of 6, how are they actually doing? I can't answer that question because we don't ask that question in Canada and we don't actually collect the data. We also know that this development that's happening, it's profound, it's unique, it doesn't repeat at any other time. We've missed the most robust period of development in the brain.
Decades of brain science has made it abundantly clear that the early environment of a child is a major determinant of brain development and therefore the long-term mental health of children. The longer we wait, the harder it becomes to correct a delay or a vulnerability or a risk. This needs to change.
We know from a huge study that was done over 20 years ago, at that time, 25% of kids under the age of 5 were at risk for social, emotional, or behavioral disorder. Well, since then, we've been through a pandemic. We already are seeing in some communities the risk for developmental delay for babies born during the pandemic has exponentially grown.
Canada's current approach to promoting positive mental health and well-being actually fails to recognize and respond to infant and early mental health concerns. Not only this, but Canadian practitioners and families have little to no clear direction on how to navigate services and supports addressing infant and early mental health.
The primary goal of this project is to address a gap in services that exists for young children, to create that portal, that entryway.
The Infant and Early Mental Health Care Pathways project comprises of 5 phases and is currently underway in 8 Ontario communities. In phase 1, it's essential to really identify who are the key partners in the community. And then in phase 2, we have all of these key partners coming from different sectors to map out these services currently available for children under the age of 6. This way we can analyze their strengths and challenges and utilize that to form their aspirational pathways in phase 3. And this way also we can implement an implementation team. At the same time, supervisors and frontline practitioners really train on a vital screening tool, and that's called the Ages and Stages Questionnaires and the Developmental Support Plan. Now, in the final phase, the pathways are distributed to all the services for children under the age of 6, and surveys and focus groups take place.
This information is shared with the community because it's their data to begin with. We don't take ownership of any of the data, but then they can see it right away and say, okay, here's where our deficits may be, or here's where our strengths are. Like, how can we leverage our strengths and how can we get support for the areas that need them, like right off the bat?
So those local champions are critical for the process because implementation won't work unless there's a commitment. That leadership has to come from within.
So every pathway looks different. This is not a one-size-fits-all initiative. We don't get to go in and say, okay, you all have to fit this map. This is what it has to look like. We actually go in and say, tell us what you do. Tell us where your strengths are. And let's work with that and build on that to create a system of care pathway that is actually doable. So the best model is a community-driven model.
There's so many things that excite me about what is going to come from this, but what I'm really excited about is the present, that this is happening right now, real time, for families who need it, for practitioners who are looking to help and support in the best way they can, for communities who are looking to empower their families, who are looking to give better services, quicker and a more accessible, more equitable way.
This work is literally life-altering. It isn't just about doing something better or doing something differently. The creation of system of care pathways and children actually being supported earlier than systems currently allow will literally change a child's life. And when you change a child's life, you change a family's life. When you change a family's life, you change a community.
What I would like to see change long term, no child is left behind was overlooked when it comes to improving our long-term mental health.